We are back with Lindsay Causey with Cone Health Center at Wesley Long Hospital. We're talking about breast cancer awareness and screening. So let's talk about this. Are there other maybe risk factors that we haven't talked about that we should be aware of when it comes to breast cancer?
There are. So some of the risk factors that can increase personal risk include age. As you get older, naturally, that is a risk that unfortunately none of us can avoid. Another risk is being overweight or obesity. So trying to get your weight down to a healthy level is really important because that can increase your risk, especially after you've gone through menopause. Another risk factor includes not exercising. Then also smoking is linked to higher incidences of premenopausal or before going through menopause breast cancer. And so trying to avoid those risky substances. Alcohol is said to increase the risk in a lot of patients. There's no safe amount of alcohol that we know that can be safely consumed. So trying to limit any alcohol intake is key. There are other things that can reduce your risk, such as breastfeeding for at least a year. That is one that is important. And also, other risk factors can include hormone replacement therapy, and certain types of hormone replacement therapy can increase breast cancer risk. And that is important if you are taking that to talk to your provider about it to understand how that may impact your breast cancer risk and screening.
So there should be things that people at home should look for in their breast, like what changes should they be looking for that may indicate, hey, I really do need to go see my doctor.
Yes, and so the main things are any skin changes that can be dimpling or puckering or an indentation that you didn't notice that is new, nipple changes or nipple drainage. And by nipple changes, if your nipple normally sticks out and then it's all of a sudden going in or vice versa, that is an abnormal breast change that should be evaluated. And then a lump, a bump is obviously something that we want to look at. Another thing to bring to your provider's attention is if you have any swollen lymph nodes. That is important, and lymph nodes are under the arm, and so if you have any swelling or a new area of concern there, should bring it to attention.
Like if it's soft to the touch or like it hurts to the touch kind of thing?
So typically I say anything new or unusual that's persistent, you should have evaluated.
Okay. What are some of the biggest misconceptions that you're hearing from patients, either about mammograms or about breast cancer, that you just really want to set straight today?
So, biggest misconception is the amount of radiation exposure. The radiation exposure from the mammogram is very low. So, it really is important to get your mammogram. The benefit far outweighs the risk of any radiation received during that imaging. And then the second thing about breast cancer in general is that it's not a one-size-fits-all diagnosis. And there's many different kinds and types. And so the best chances you have to reduce your risk are to get your mammograms to have it be more treatable.
Every single year. Okay, and if someone's watching this interview later on and they skip their mammogram, what do you want to say to them?
Do not delay this important life-saving screening. I highly recommend that you prioritize your health and well-being and go and get your mammogram as soon as you can get an appointment scheduled.
Okay, and real quick, some steps that women can take to reduce their risk of breast cancer?
So, healthy diet, avoiding processed foods, simple sugars, and sweetened beverages and sweetened foods. Additionally, you should exercise. Really, sitting is the new smoking. Get up, get your steps in. Women who exercise 150 to 300 minutes a week have better outcomes than women who don't. And so exercise is really important. And then avoid those risky substances, whether it's tobacco, limit alcohol, very important.
Okay. We appreciate your time and your expertise. And if you missed any of this, this is going to be in the To Your Wellbeing section of our website. We're going to get a quick check on the forecast.